Now we will learn posterior compartment of leg. This is the posterior view or the dorsal aspect of the model of right lower limb. The posterior compartment muscles is divided into two groups, that is the superficial group and the deep group. Superficial muscles are, we all know GST, but here is the GSP. G for gastrocnemius muscle in white color. Gastrocnemius muscle, this one, medial head and lateral head. Then comes soleus muscle, soleus, and the plantaris muscle. These three are superficial group of muscles, and the deep muscles are flexor hallucis longus, tibialis posterior, flexor digitorum longus, and this black one, this is the popliteus muscle. Okay, so these four are the deep muscle. Now first come to the superficial group of muscles. First, gastrocnemius muscle. It has got two heads, medial head of gastrocnemius and the lateral head of gastrocnemius. This is the medial side and this is the lateral side. Medial head of gastrocnemius, it arises from the popliteal surface of the femur, over the medial condyle of femur. This is bony, the model showing the bony landmarks. This is the femur, this is the knee joint, this is the femur, this is the tibia, and this is the fibula. This is the posterior aspect, of the medial condyle of femur. This is the lateral condyle of femur. This is the medial condyle of the tibia, lateral condyle of the tibia, and this is fibula. Okay, this is like our knee joint. So from where the medial head of gastrocnemius is arising is the popliteal surface. Here is the popliteal surface, just above the medial condyle of femur. Here from it arises. And the lateral head of gastrocnemius, it arises from the, not from the popliteal surface, it arises from the lateral aspect of the, not here, lateral aspect of the lateral condyle of femur, from here. Okay, and the medial is from here. Popliteal surface just above the medial condyle and lateral aspect of the lateral condyle of femur. Okay, now both unite. Okay, and first come to the, and then it forms a tendoachilles tendon, a common tendon, along with the soleus muscle. Okay, and now it insert on the posterior surface of the calcaneum. The posterior surface of the calcaneum which forms the heel bone, the middle 1/3 of the posterior surface. Okay, tendoachilles. And the soleus muscle, this is our soleus muscle. It has got wide distribution of origin. It arises from the head of fibula. Okay, posterior surface of upper 1/4 of fibula, upper 1/4, and lower 3/4 gives origin to the flexor hallucis longus. So head of the fibula, posterior surface of head of fibula, this one, as well as the upper 1/4 of the posterior surface of fibula. Then then as it is superficial, and then comes the soleal line. Here is the, as the name itself says, soleus, so it is attached at the soleal line. This is our soleal line. It lies on the posterior surface of the tibia, soleal line. So head of the fibula, upper 1/4 of the posterior surface of fibula, then along the soleal line, and then medial border of the tibia. Okay, medial border of the tibia, like this. All this area gives origin to the soleus muscle, and again it unites with the gastrocnemius muscle to form a common tendon known as tendo-achilles and get inserted into the middle 1/3 of the posterior surface of the calcaneum. Okay. Now third superficial muscle is plantaris muscle. It takes origin from the lateral aspect, as this is the right limb posterior aspect, this is the medial and this is lateral. So lateral aspect of the lateral supracondylar ridge in the femur, above the lateral condyle, this one is known as lateral supracondylar ridge, and on the lateral aspect, from here plantaris muscle arises, like this, plantaris muscle. And this tendon of plantaris muscle is very thin. This is also known as Fresman's nerve, because the fraser which are doing the dissection, during the initial period of the dissection, the medical student confuses the tendon of plantaris muscle with a nerve. That's why the tendon of plantaris muscle is also known as Fresman's nerve. Okay, and this get inserted on the medial aspect of the tendo-achilles. Okay, now coming to the deep muscles of the posterior compartment of leg. First, flexor hallucis longus. It arises from the lower 3/4 of the posterior surface of fibula. This is the lateral aspect and this is the medial. Okay, so lateral aspect and the medial aspect. Laterally fibula. So posterior surface of the fibula, lower 3/4, and flexor hallucis longus, it get inserted on the dorsal aspect of the base of the distal phalanx. Okay, now come to the second deep muscle. It is the tibialis posterior. It arises from this flexor hallucis longus arises from the posterior surface of fibula, but the lateral half, medial half of the posterior surface is given to the tibialis posterior muscle. Not whole of the posterior surface gives origin to flexor hallucis. The posterior surface of the fibula is divided into lateral half and the medial half. From the lateral half, flexor hallucis longus arises, and from the medial half, it is tibialis posterior muscle. Okay, as well as the in between the two muscles there is intraosseous membrane. So from intraosseous membrane, and this is the posterior surface of the tibia, but lateral half. Both posterior surface divided into lateral and medial half. So here is the medial half, intraosseous membrane, and then this is lateral half of the tibia, but below the soleal line. At the soleal line, which muscle arises? Soleus muscle. And below the soleal line, tibialis posterior in the lateral half. Okay, and now tibialis posterior, it get inserted after passing through all these muscles, flexalis, longus, and both all passes through the flexor retinaculum. After passing, it get inserted into the all the bones except talus and first metatarsal, except. So where it is inserted? It is inserted into the second metatarsal, third metatarsal, second metatarsal, third metatarsal, fourth metatarsal bone. Okay, and this is going to the navicular bone, and one slip is going to the sustentacular tali of the calcaneum. So it has got wide area of insertion, not only inserted into the talus, and rest of the bone it gives slips. Tibialis posterior muscle. Okay. Now what next? This is flexor digitorum longus. On the medial most position, flexor digitorum longus, it rises from the posterior surface of the tibia, but medial half and below soleal line. Okay, now it passes through the flexor retinaculum and give rise to four tendons, lateral four tendons, 1, 2, 3 and 4, and get inserted into the dorsal aspect of the base of the distal phalanx. Okay, so this is all about the superficial muscle and the deep muscle of the posterior compartment. Now coming to the nerve supply. The posterior compartment muscle is supplied by the tibial nerve. This is our sciatic nerve divided into common peroneal and tibial. Now tibial nerve is supplying the posterior compartment. Tibial nerve, after passing through the flexor retinaculum in yellow color, this one, tibial nerve, this gives the lateral plantar nerve and the medial plantar nerve, this yellow color. Okay, this is our tibial nerve. And what is the arterial supply of the posterior compartment? The posterior tibial artery. This one is posterior tibial artery. Posterior tibial artery arises from, this is our popliteal artery divided into anterior tibial, which passes to the anterior compartment after piercing the upper border of the interosseous membrane, and this is posterior tibial. This much portion is also known as tibiofibular trunk, because it sometimes give impression that it is a common trunk which gives posterior tibial as well as the fibular artery. Fibular artery is also known as peroneal artery, which supply the lateral compartment of the leg, and posterior tibial supplies the posterior compartment. So this is known as tibiofibular trunk, and this is our posterior tibial artery. It passes through the flexor retinaculum and divide into the medial plantar artery, this one, and this is the lateral plantar artery. Lateral plantar artery, here, lateral plantar artery, this one, it make an anastom, it become continuous with the deep plantar artery. Deep plantar artery is the branch of dorsalis pedis artery. Deep plantar. Dorsalis pedis ends by giving two artery, that is the first dorsal metatarsal artery and the deep plantar artery. And the deep plantar artery come into the plantar aspect and unite with the lateral plantar artery to form the plantar arch. And also the plantar artery gives first plantar metatarsal artery also. Okay, and this is our medial plantar artery, this red one, medial plantar artery. Okay, so this is the nerve supply and the blood supply. And one thing more, posterior tibial artery, this one, posterior pulsation of posterior tibial artery is, it is palpated in the middle of the attachment insertion point of the tendoachilles. This is our tendoachilles and this is medial malleolus. In between at the midpoint, if we draw an imaginary line from the insertion of the tendoachilles to the medial malleolus, the midpoint of that imaginary line, here we palpate the posterior tibial artery by putting 3 finger over there, 3 parallel finger just parallel to the leg, and this is given one particular name. One particular name is that I'm just not remembering. Okay, so posterior tibial artery is palpated here. Okay, now this is our flexor retinaculum. In order to arrange this tendon of flexor muscles, anteriorly there is extensor retinaculum and the posteriorly there is flexor retinaculum. It is attached superiorly over the medial malleolus and the inferiorly over the margin of the calcaneum, and it has got 4 compartments from medial to lateral. In the extensor retinaculum there was a mnemonic, the Himalayas are not dry places. Here there is exchange between the extensor hallucis longus, hallucis and digitorum. So here will be the arrangement, tibialis posterior, then flexor digitorum longus, then comes artery and nerve, posterior tibial artery and the tibial nerve, or you can say posterior tibial vessels and nerve, and then at last come flexor hallucis longus. There are 4 compartments. Okay, and one thing worth mentioning, that here is the crossing of this blue in light blue color. This is the tendon of flexor hallucis longus. Okay, going to the great toe, and this flexor digitorum longus, it is going to the all lateral toes. Here it crosses each other, and there is some fiber of flexor hallucis longus, this is sky blue color, it intermingle here with the fiber of the flexor digitorum longus, which is called William Turner's slip. William Turner's slip. Okay, and about the action, all the muscles are the plantar flexor. It is passing through the plantar aspect. So these are the plantar flexor. This digitorum longus and the hallucis longus going up to the proximal phalanx. So it does flexion of the toes. Hallucis longus, flexion of the great toe, and digitorum longus, flexion of the lateral 4 toes. Okay. So this is all about the posterior compartment of the leg. Thank you.